Well, what is a stroke? What does a stroke do to your brain?
Sure. So a stroke is a problem caused by damage to brain tissue. And that damage is caused by either a blockage of blood flow to the brain tissue, which is an ischemic stroke, or bleeding directly into the brain tissue, which is a hemorrhagic stroke. Different parts of the brain control different parts of the body and different functions. So the symptoms you can have from a stroke will depend on the area that the stroke affects, but commonly strokes are associated with problems with movement, problems with speech, problems with vision, problems with cognition, and independent function.
So, for the people at home, how can people learn the signs of a stroke?
So the commonest signs of stroke can be remembered by using the acronym FAST. So for FAST stands for face, arms, speech, and time. So face, you look to see if one side of the face may be drooping. Arms, you see if one arm is not able to raise up as well as the other. Speech, you need to see if it is slurred or jumbled. And even though time isn't a symptom, it's in the acronym because time is so important in treating stroke. The brain is very sensitive to changes in blood flow, and so it's very important to call 911 or the local emergency number right away so that people can get medical attention in order to treat the stroke.
As well, here in northern BC, are there like any system, to help with heart and stroke, like any health system?
Sure. So there's a provincial network. We have our stroke expertise in terms of the kind of most advanced and complex care located here in Vancouver. But we have a provincial pager system where people who treat stroke locally in the emergency room in different hospitals can call us to ask for advice. We're able to view the scans remotely on our own computers and phones. And then we can determine if there's any advanced treatment that someone who is far away may benefit from. So sometimes we will transfer patients to our center if needed through helicopters or planes or ambulance.
So, what do you want listeners that are listening to take home on the topic of stroke?
I think people need to know that stroke is a medical emergency and that treatment can reduce your risk of having death or disability as a result of this terrible disease. Treatment is time sensitive, so if people display symptoms and again think any difficulty moving one side of the face, arms, speech, other symptoms can include sudden changes in vision, dizziness, headache, trouble walking, or other changes, people should call 911 right away or their local emergency number so that they can get assessed as soon as possible. The other thing that people should remember is that just because you have symptoms of a stroke that may be there and then go away, it's still a medical emergency because it may be a warning that something more serious and permanent may come very quickly. So that also needs assessment right away.
So, time is definitely important.
Time is definitely important. Getting timely medical attention is very important. And also, it's good that it's mediated through your emergency services. You shouldn't try to drive yourself to the emergency room because there are advanced warning systems in place. If paramedics see someone that has symptoms of stroke, they can activate and inform the hospital in advance so that we can treat someone as quickly as possible.
As well, where can people find more information about heart and stroke?
So people can go to the website for the Heart and Stroke Foundation. There's very good information for both members of the public, stroke survivors and their supporters, as well as medical professionals. So that's www.heartandstroke.ca.
Dr. Field, it is awesome to have you here today.
Thanks so much again for having me, and I'm very happy that you're communicating this information to the public. It's very important. Thank you.
Have yourself a great day.
You too. Take care. Bye-bye.
Don't worry, while you social distance, you can still hear all your favorite songs in the comfort of your own home from Moose FM.